Assalamualaikum warahmatullahi wabarakatuh. My name is Anjad bin Rahman and I will elaborate about our use case diagram. If you see our use case diagram, we have an actor like doctors and pharmacists, technician and pharmacists. Okay, I will explain about our roles of the doctor, pharmacy technician and the pharmacist. Okay, first we have doctor. Right, we put it doctor to the write prescription and then they discuss about prescription. Is it because the prescription is sent to the pharmacy when the doctor enter the patient information, the drug and the dosage. Next, we have discussed about the description. If the doctor has any queries or question or concern, they can speak to the pharmacist or pharmacy technician about the prescription. Next, I will explain about pharmacy technician rules. We have review prescription and then send prescription to the pharmacy station. The rules, why we put it in the review prescription, the pharmacy technician reviews the prescription to make sure the dosage is safe and then the medication will not interact with any medication that the patient is taking. Next, we have sends prescription to pharmacy station. It is because depending on the kind of drug being prescribed, the pharmacy technician sent the prescription to the proper pharmacy station. Lastly, we have actor pharmacist. We put it to the review order and then check to the patient order. To ensure the prescription is accurate, the pharmacist look over the patient file and then the prescription. That's why we put it on the review order. Lastly, we have checked the patient's order. It is because patient has any allergies or any medical issues that could affect the prescription. The pharmacist can examine the patient's document. That's all I have to say for my presentation. Thank you.
Okay, move to data flow diagram level 0. For the explanation, data flow diagram level 0, it is a high level overview of the system interaction with external entities is provided by data flow diagram level 0. Okay, the Mercy Hospital system is the primary process in this instance, and the pharmacy technician, pharmacist and billing department are external entities. Pharmacy technician receive prescriptions from doctors, and doctor at the hospital write prescription for patients and specifying the medication and dosage that required for treatment. Also, the pharmacy technician is responsible for receiving this prescription from the doctors. Furthermore, after reviewing the prescriptions, the chemist fills them and creates the prescription labels. Also consults with doctor the drugs that necessary. Moreover, the chemist delivers the prescription labels and filled orders to the nursing station in charge on the patient case. And finally, the patient's admission number, drug type and amount dispensed and prescription cost information are sent to the billing department.
Alright, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Putra Muhammad Nur IDB Muhammad Tua. My matrix number is AA220803. Today I would like to explain you about DFT level 1. Basically, the DFT level 1 is a further explanation from the DFT level 0, which is Khairul Ibad before just explained. Alright, without further ado, I would like you to know about what are the diagram involves. Here are some of the keys of takeaways from the diagram. The process starts with the patient seeing a doctor. Well, the doctor reviews the patient medical history provided by nurse and then write the medication prescription. Other than that, the prescription is sent to the pharmacy, where a pharmacy technician reviews it and send the review prescription to the pharmacy station. Then, a pharmacy station will get the prescription type and being reviewed by the pharmacist, whether is it filled the order or not. If not, pharmacist will discuss with doctor, and if the order filled, the the pharmacist will write prescription label. After that, pharmacist will check the patient file to provide the dosage level and will explain the drug information to the patients. And lastly, the billing department will be in charge of medication payment. Overall, the diagram is useful to understanding and communication the process of prescribing and dispensing medication. It can help to identify potential problems with the process and to make sure that everyone involved in the process understand their roles and responsibilities. Thank you.
I would like to explain about our operational feasibility. The operational feasibility of the system depends on the availability of qualified pharmacy technician and pharmacists to operate the system. The system must be easy to use and navigate, and it must be able to handle the volume of prescriptions that are filled each day. The system must also be able to integrate with the hospital's electronic health system (EHR) system, so that pharmacists can easily access patient information. Additionally, the system must be able to track the inventory of drugs and medication, so that pharmacists can ensure the hospital has the necessary supplies on hand. Finally, the system must be able to generate reports on prescription filling and drugs usage, so that pharmacists can track the effectiveness of the system, identify any areas where improvement can be made. That's all I have to say. Thank you.
Okay, so I will presenting about the economic feasibility. The economic feasibility of the system depends on a number of factors, including the cost of the system, the cost of training staff on the system, and the cost of ongoing maintenance and the support. The potential savings from the system, such as reduced errors in prescription filling and improved efficiency, must also be weighed against the cost. If the potential savings are significant, then the system may be economically feasible. However, if the costs outweigh the savings, then the system may not be economically feasible. By implementing the system, could minimize the possible financial loss brought on by errors or inefficiencies, optimize resources utilization, and save manual labor.
Next is technical feasibility. The technical feasibility of the pharmacy system depends on the availability of reliable hardware and software. The system must be able to run the hospital's existing IT infrastructure and must be able to meet the security requirements of the hospital. Additionally, the system must be able to be integrated with other hospital systems, such as the electronic health record system and the billing system. If the system can meet all of these technical requirements, the hospital staff will find the system more dependable and practical for carrying out their tasks.